Okay, thank you. Welcome to all. And this is the first session for the statistics from 2017. I'll just go through the statistics form. I'll just explain one by one section. And if you have any doubts or something like that after each section, I'll stop and I'll ask. I'll give you time for your questions. Is it okay?
Yes.
Okay. So this is the statistics from 2017 which you see on the screen. Hope you can see this full screen, right?
Yes.
Okay. So this is the first of all, the projects, this statistics form sheet is protected, and the only the cells that needs to be required to be filled in by partners, which are in yellow, and only these cells which are in different color, they can be edited by the partners, and none of the white cells will be edited by the partners. Okay, first we start with the project number.
Yeah.
Yeah,
Yeah.
here as you see, there will be a pop-up message coming up in each cell, so that it will guide the partner on how to fill in the statistics form, which will help them to know what needs to be filled in the statistic form. First we start with the project number. Here if there is anything like the project number is something like 2015/2017, they have to fill in the full number. Or if there is something like 2568 hyphen BMZ hyphen 2017, or sorry, or MYP, they have to fill in the full number. This is just to make sure that the statistics form goes to, when it is imported under the correct project number. If there is any problem in this project number, the statistics form will not be uploaded. It will be rejected for uploading. So we have to make sure that the project number is entered correctly as mentioned in the Navision or in their project contract. Okay. Next, this is the year which cannot be
Okay.
edited. The months you see here. Here the January to June is pre-selected. For the next semester, if they want to send the form, they can just go here and change it. So July to December. So for first it will be pre-selected as January to June. So they can just fill in the for January to June. The sub-project number and sub-project name, this is for the convenience of the partner. For example, if this project number, just for example 2568 BMZ MYP, if this project is working in 3 different districts, for example district A, district B, district C, what they can do, they need not sit and consolidate the statistics. Very simple, they can just select here 01 and type district name or whatever they want to uh, uh, give the name, and fill the data related to this district. And they can use the same form, make it as file save as copy with the same project number, and select 02, and say they can fill it any name, and they can send. So what happens in the Navision is, all the, for example, if there are 3 statistics form filled in by this project, all the 3 will get uploaded into the Navision as 1, 2, 3, and the consolidation of the numbers for this project number will happen automatically in the Navision. So the project or the statistics officer need not worry about the sitting and adding the numbers. So this is related to the first section, it's on the top section. Yeah, if you have any questions. Yeah, no questions, I can move on.
Sorry, Venkatesh.
Yeah, please.
What if there's I'm a project officer for the Seeing is Believing project.
Okay.
and we don't have a sub-project number. So what happens then?
What do you mean by sub-project number?
Now I'm referring uh, to the top left
Yeah, here.
number.
Okay.
Yes. So there's the project. There's a project, then there's a year, months, and then there's a sub-project number.
Okay. How it is in the Navision? Is it for each sub-project? Is there a separate project number?
Yes, we have separate project numbers,
Okay.
but
Yeah.
yeah.
Then if in the Navision, if it is separate project number, then you have to fill in the same number what is there in the Navision, the project number here.
Yes. Okay.
Then there is no there is not required, you need not require worry about this sub project number and sub project name. If this number is 2568 BMZ MYP, you mean to say -01 or something like this, you have, right? Which is
Yeah.
which you have, if
Yeah.
you have in the Navision, then you have to fill in accordingly, say different statistics form 01, 02, 03 like that, and send the forms. Then you need not worry about this sub project numbers. If in
Okay.
case there is only one project number, but it is in working in 3 different districts or 5 different districts or 10 different districts, they can just send the district wise related information, so that it gets consolidated automatically. And in future, you should make sure that the same project number is sub project number is used for the same. For example, 02 is used to Jana, then you have to make sure that in future also you give 02 to Jana, so that there is a comparison of the previous data of the same district in continuation. Hope it's clear. Any more questions,
Okay,
please?
Venkatesh.
Yeah, please.
Sorry, can I ask you something?
Yes, please go ahead.
Here you have talked about this if the one project is implemented into 3 different districts or 2 or whatever. Okay,
Okay. Yeah.
but what if the project is implemented? I mean, it's one project implemented in different regions,
Okay.
and in a particular region there are also different districts.
You
Now,
mean,
which statistics should be reported based on the regions or based on the districts?
see, for statistics, it is very simple. The project number what you see on the top, that should be the same as in the
Mm,
Navision. That should be the first logic. The
sure.
second logic is if this project number is having implementing, for example, in 3 different regions, that's what you mean to say, right?
Yes.
Then zero, here you can just say 01. You can select 01 and put the name of that region, and 02
Okay.
name of that region, 03 name of that region. After that, in that region, if there is again split of the district, that is not possible.
Okay. Okay.
Only one step is it will allow. For example, if one project is working in 3 different district or 3 different region, one step it allow. After that, there is no other option of for that.
Okay. Okay.
And you can use it. For example, if this project number is having 3 different work areas, for example, health, CBR, and education, and if the project is, if for example, if the project is working in health area in one district or one region, and the same project is working in CBR in different region or something like that, or it is a very big hospital or very big project where all the consolidation cannot happen, but but they can give only department wise for this so like that, then you can use the same project number. Then you can just put 01 health and 02 CBR, 03 education. So according to the departments, if they give the data, even that is possible to get. You can use the different forms, and it can be consolidated.
Okay.
Yeah. Yes, any more questions, please?
It's okay.
Okay. Next, if there is no more questions, then I'll go to the next section. Next section is, this is what you see here. I'll just enlarge the screen so that it's easy for you to see. Next section is this 100 to 1001. This one, you see, for example, various types of disabilities here in this
Yes.
here. You see various types of disabled people, and if you come to the right, it is one. It is number of persons with disabilities enrolled or registered in CBID, and number of persons with disabled enrolled in your education program. It is this. It is the same. For example, if a person is say, okay, if they say 10 men and 20 girls are visually impaired, and they are enrolled uh, in your program, for in the first semester report, January to June, this should be opening balance at the project plus any new additions made during the year of this 2017 between Jan to June. They should put those numbers here. And if it is an education program, they do the same thing. For example, something like this. I'm just giving a rough figures here, right?
Okay.
Okay. And so if they have different people, I'm just giving some rough numbers just for our convenience sake. So if you go to each cell, it will just pop up a message what needs to be filled in. That is very clear in all the yellow cells wherever you see. And if, for example, if for this row, if they want to give some comment, the region the partner wants to give some comment, uh, something like only something like this. It can be given. This comment also will get uploaded into the Navision. So the partner should make sure that the uh, comment is given to each row, and they should not combine this. They should not wrap text or do the one comment to the whole section like this. It will not get uploaded. It will reject. Only to they should not edit anything. They should just give the comments to each row if they want to give anything comments. So this is related to CBID registration or people enrolled for CBID, and here they put the people enrolled for education. In the beginning, in the Jan to June, they'll just put whatever that the people are there at their project in the beginning of the January, plus what the people who are being enrolled during January to June. This is the section what they needs to fill in that. And in the end, in the column here, we have given the short guideline what needs to be filled in, how to fill in. So this is related to this top. uh, and please, if you have any questions till now.
Venkatesh, this
Yeah.
is Kirsten speaking.
Yes,
Good,
Kirsten.
good morning
Good
from
morning.
Rwanda. So, yeah, I had a bit of issues with my internet, so I came in a bit late.
Okay.
I'm still trying to figuring out, but at least the internet works, if not my emails.
Mm-hmm.
So maybe I think this is here important for the people from the country office to say where our partners have issues, because if you explain it like that,
Mm-hmm.
it may be all very clear.
Okay.
But I now asked, Patricia and Peter and Rainer, and then I don't know if who else is listening from the ops team, who are actually working with the partners. What are the issues our partners face to understand this?
Okay.
So I think that will be very helpful. So I don't know if some of the team can share their experiences here.
Yes, please. That would be very good. Thanks, Kirsten.
Yeah. So Peter or Peter, Raina, Patricia, or Jackie, or anyone who's talked to partners about this, maybe you can help us understand what the issues are for the partners to understand this and do it correctly.
Yeah.
Okay. Thank you, Kirsten. First of all, good morning.
Good morning.
Good morning.
The issue from partner, there, for instance, on the line of health, that is health section, row number 49 and 50.
No, that will come to later. If we are coming down, then in this section, if they have any problem, each section will talk section by section so that it's very clear. In this section, do you face any problem or any questions from the partners, or if they are feeling any if there is any clarity required on this section? Just these rows what we have discussed till ST 1000. Only these two.
Okay. Okay.
Hi, Venkatesh.
Hi. Yeah. Yes, Jacqueline.
Hi, I have a question on that part.
Yes.
The registration of the disabled and then under CBID, if there is a disabled child, for example, who has been registered at that point and then again registered for the education program, do we is it allowed to register still under the CBID and then again have the same person registered on the education program?
They can do it, logically speaking, they can do it and put a comment saying that, for example, if you say here, these 10 men are registered for CBID and also education. They can just put a comment saying that 10 men are registered for both CBID and education, so that it's very clear for us.
Okay, that's clear.
Yeah. Any more questions?
I have another. Yeah, I have one, Venkatesh. Sorry.
Yes, please.
So if for me, it's quite clear: visual impairment, hearing impairment, etc.
Yeah.
However, that's only on paper. The reality, and if you stand in front of a person, they could have a hearing impairment and they could have a speech impairment.
Yeah.
They could also have a physical impairment.
Yeah.
So how do we ensure? What is the criteria? What do we now tick? Because then we can't tick 3 times.
Yeah, no.
But it's only one person.
Yes, good question, Kirsten. For this, that's the reason we have given a row for multiple disabilities here. For example, it clearly says multiple disabilities means more than one disability. If they see more than one disability for a person, then it goes under multiple disabilities. There might be a situation where all the people in a project, they might be having more than one disability, so they will put everyone under multiple disability. And if they want to give some notes, they can just put their notes in the comments.
Okay. Yeah. Okay. Yeah.
Yeah. Karen wants to add something.
Yeah.
Yes, Karen. Karen? Karen, we can't hear you. Okay. Maybe she will let us know again when she's back. Okay. Yeah, she is putting in the chat saying that I was wondering if there is really 2 programs. It depends upon the situation. If it is one program doing both education and CBID, this will be the case. And as I told you in the beginning, if they want to fill in 2 separate data sheets, one for CBID and one for education, they can even do this by using the subproject function, saying that 01 is CBID and they can do the second one, 02 is education. So it's very clear CBID data is different and education data is different if they want to. Okay, I'll just move on to the next section. And yeah, okay, The next would be we have inserted some conditional formatting just to ease the partner when they're filling in. If there is anything wrong, it just highlights in red. Just for example, there are 15 in total here which cannot be edited by them. They just put the numbers on the top, and here for ST1000 you just see, for example, boys 15. Here, for example, if they say number of children 0 to 5 years for early intervention, if they've put 25, you just see the 15 highlighted in red. It means that there is something wrong. So there, until it is these two figures are equal, or if this the ST1000 is greater than this number, it will not change to the red. You got my logic? It is nothing but this is a thereof code, which means this 40 persons already includes this 25. This is the logic here. This is just to make sure that when they are filling in, if they are filling anything wrong, so that it gets highlighted. Okay. Any questions on this? Okay. Next, on row number 30, what you see here, this is the new statistics code, which is in 2017. For example, as you can read, I'll just make it bigger so that everyone can view. I'll just read it out. This is a new statistics forecast. This is total number of persons with disabilities projected, that is approximate figure, to be enrolled or registered in your program from 1st July to 31st December for the total number under statistics code 1000, which means here you are just filling one number. For example, here you see 110 as total, right, for this code ST1000. So for Jan to June you have 110. For example, in the next 6 months, how many you can, what is your projection, that just to know how many more can be enrolled? Maybe say, okay, another 50 people in total may get enrolled. That's your projection. This is just a projection. This is just to this is a new code forecast. This has been given just to know that if we add the projections, because the MAs wanted to know what is the approximate reach in a year. So for that sake, for the convenience sake, and also to know that, for example, if there is a very huge deviation from previous years, for example, last year we reached around 10 million, and after adding all these numbers, if we are going to 8 million or 9 million, so we get already a signal saying that, okay, this many 2 millions are down, so that we can check where is the 2 millions going down and how can we rectify. So that it's a precautionary measure that we need, that we are planning just to ensure that we are on the track. This is just an approximate figure. This will be for CBID, and here you will see for education you have, for example, 60. So in education, say for example in the next semester you may enroll more than that. That's not a problem. But this is an approximate figure which will be given by which should be given by the project. If they want to give any comments, the same way they can fill in the comments in the comment section. So do you have any questions on this new code?
There is a part that says number of children 0 to 5 years of age receiving early intervention.
Yeah.
So I didn't get that part, because if we have 18 years up there for boys and girls.
1 second. I'll just, yeah. Here, what you see is children below 18 years, which means it already includes the children who are 0 to 5 years. This section already includes. This means the 40 what you see on the top, this includes 25, because this is a thereof code. Thereof means which is a part of the above line.
Okay.
For example, if there are 40 children, in these 40 children, it is already including this 25 children. This is already included.
Okay.
Yeah.
How do you get that?
Yeah.
How, okay, still on that, Venkatesh, how do you get the 25? Is it something that when you're recording?
It is the project we have to fill in. For example, there are 40 boys who are registered for CBID in a project. Okay.
Yeah.
That means all these three numbers, what you see on the top, 10, 15, 15, just for example. This is the 40 numbers. There are 40 boys in the project. In that 40 boys, how many are between 0 and 5? There might be 15 numbers or 25 numbers or whatever may be the case. But they should not say there are 60 boys who are 0 to 5 of the age, but the total enrollment is only 40. You get my point?
So the 25, it comes from the numbers above, and it's irrespective of
Definitely.
any of the impairment.
This is the total number of boys. For example, this is a 40 number of boys are in the project who are enrolled for CBID. Out of these 40 numbers, how many are in between 0 and 5 who are receiving early intervention? Out of these 40 boys, there might be 25 boys or only 5 boys. Do not know. Who are in between 0 and 5 out of these 40.
Venkatesh?
Yes.
Can you hear me now?
Yes, Karen.
Good. Okay. I mean, this is enrollment and registry. So if you have a CBID or education project, it's supposed to be students, for example, who are registered and are in a follow-up. So it's not a one-off. You know who is in your program. So you also know that the age that your clients have. So it shouldn't be a problem for a project to say, okay, of the group who are within the children under 18 years, there's also a group of children who have early intervention, and they are in between 0 and 5 years old. And they should know from their project documentation that there is, for example, 10 or 15 or whatever, how many children who are in this age range, because they are known to them. They are registered children in their program, and the above is the total. And within the group, there might be some of the children who have early intervention and who are up to 5. I think does it make it more clear?
Yeah. Is it clear now?
Yes.
Okay. Thank you, Karen. Yeah, we now just go to the next section. Here, in this next section, there is just an option of clicking yes or no. For example, if the project has community-based inclusive development CBID approach, they can just go here, click and just select yes. And if they want to give any comments to it, they can give it. Right? And if the project is having also mental health, they can click yes. And if the project is also into IDRR, then they can click yes. Right? This is just to know how many projects are doing CBID or focus, IDRR focused. I hope this is...
Yes, and we are...
Yes,
we are distinguishing between projects who have a focus in CBID and those who have a linked CBID project. Yeah, that's linked. That's different. Like you would have an eye project, I don't know, cataract surgery or whatever, and it's linked to a CBID project for their clients for follow-up or whatever. Maybe that's not a good example, but you get the idea. And the first one is really like a CBID project. That's their main thing. That's what they're doing. And the second one is there's a link to one. So to see how comprehensive our programs are.
Okay. Thanks, Karen. Any questions on this one?
No.
Okay, then I just move ahead to the next section, which is medical services. Okay, here in the medical services section, you see number of persons and thereof number of persons with disabilities. For example, in vision, you say, okay, there are 100 men, say 100 women, 50 boys, and 50 girls who are receiving services for vision in the first semester. Okay, out of this 100, maybe this 100 has been arrived saying that okay, 80 persons have come from screenings and 20 are from the previous year clients. Okay, and for this 100 there might be say 50 people who are receiving vitamin A, treated with vitamin A. So this is the logic. For example, if you put say 50 here and say 100 are come from screening, then you will see a red on the top, because this line includes, as you can see the background text. I'll just increase the zoom in so that you can read the text clearly. It says boys receiving screening, consultations, treatments once or more during their at the project or program, each person to be counted only once, which means that even this number includes the screening numbers and consultations treatment. For example, if a person is counted from in the screenings, then he is counted there and need not worry about when he comes for consultations, he need not be counted again. Yeah, are you clear on this or any confusion?
Hello.
Yes.
Please, can you repeat because it's not clear?
Okay, the first line what you see in 41, row number 41, is the total
Yes.
number that is coming from screening, consultation, treatments, everything. But one person should be counted only once.
Okay.
Okay, just for example,
Yeah.
if there are 100 men, that they are showing that they have reached 100 people in the first semester. Out of that
Okay.
100, 50 might be receiving that. As you see, this is a thereof code. Wherever you see a thereof code, it is nothing but it
Yeah.
is a part of the on the top figure.
Okay.
So 50 persons are receiving vitamin A. This this 100 has been arrived because of 80 are being screened and 20 may be coming from vitamin A newly given or something like that. But one person counted only once here on the top. It might be screening,
Sure.
it might be giving a vitamin A, or it may be anything, but one person should be counted only once here. But for example, if you say 50 boys have been reached, but you say 100 boys have screened, then it will be showing as a red mark here, because this number already includes this number and it cannot be lesser than this number. So
Okay.
at least it should be 100, or it should be more than 100, or to be just to make life simpler for the projects, to while filling in we have made this conditional formattings.
Okay.
Okay, any
Yes.
questions here? Okay, next we go to the next
Hi,
column.
Venkatesh.
Yes,
Sorry.
yes, Kirsten. Yeah, sorry, I didn't get
Oh,
Jacqueline. Okay,
Jacqueline.
sorry. Yeah,
Yeah,
please.
it's okay. I'm looking at the 100 and then 50 and 80. So it's possible that if there is a child or a patient who has been screened and again receiving vitamin A can be counted twice.
Yeah,
Yeah.
see, for example, a person is
Okay.
screened and all these two, this can be mixed. Vitamin A and screen can be mixed. For example, out of this 80 people, 50 people have been received vitamin A. That's okay, because this is a different line. But here, when you are counting on the top, this line, This here you should be only one person only should be counted only once per year.
Okay. Okay.
Yeah.
Yeah, that's clear.
Okay. Then we go to the
Okay,
next
thanks.
columns. Thank you. We just go to the next columns of the same same section or same part of the medical services, which is thereof persons with disabilities, which mean this 400 is the total. Out of this for example, we go by each column. There are 100 men totally registered. Out of this 100 men, how many there are disability people? There might be say, okay, 15 men are persons with disability, and there are 100 women registered for vision who have been reached for vision services. Out of that, there might be 25 women, and here there might be 150 boys. So out of 150 there might be say 25 girls boys who have been and out this 50 here, but they should not say here, because you see in the last it is for example 50 uh, girls reached. In that they cannot say that okay, there are 100 girls who have been persons with disabilities. Then it will show a pop-up saying that there is something wrong, because this number can be higher than this number, which means because this includes persons with disability. It is total number of persons. This is thereof number of disabilities. So this should be at least 100. So this is the logic. This 450 includes 165. We just wanted to know how many persons who are reached in vision services. Out of them, how many are persons with disabilities? This is the logic. So if they are writing anything wrong, then it will pop up a red and they have to correct it. And if they want to give any comments, they can give the comments for that row. Any questions? Understood the logic of thereof persons with disabilities? Hello? Okay. The same logic will apply.
So can, yeah,
Yes. Yes, Christine.
yeah, sorry, Venkatesh. So maybe the Tanzania country office and the people in the regional office and others, I don't know who else is there. Is this understood? Or
Yeah.
because if the next time our partners again are doing it wrong,
Yeah.
we're in a difficult position. No? We're having it explained here. So if we don't fully understand it,
Yeah.
we should speak up now, huh? So that we can get it clarified.
Yeah.
But be assured, you can also contact us anytime.
Yeah.
If
Please.
there's a question.
Yes.
And
If you want.
Of course.
if you think you understood it, and then in a week you think I'm not sure about it, just contact us again.
Yes. Please.
Yeah, of course. But
Just
if we
make
now
sure
if
that
we now
nobody's
don't
afraid.
understand it, yeah. But if we now don't understand it, I mean, we're all together now, so we
Yeah.
can ask this, ask
Yeah.
now if it's still not clear, or if we know what our partners don't understand. I mean, this is now the best opportunity to share it.
Yeah.
Yep. And there is no stupid question.
Yeah, I'll just put a stupid question now, just to make it clear. Okay. Okay. You see here, 80 men.
Yeah.
Okay, and 100 boys who are screened. You have put it here, but the project fills in this. I think I should minimize for you to see the whole columns. I'll just freeze somewhere so that you can see the top columns, so that because it's clear, it is clear to me, but it might not be, you might not be able to see the screen on the top, so I just freeze it just for a convenience sake. Okay, now sorry, Okay. Yeah. Now you see. Okay. Can you see?
Yes.
Okay. So now you see there are 80 men they have put under screening and 100 boys under, and it is totally 180. And here they say there are 100 persons, 100 women with disabilities whom they have put in. Then again it automatically pops up 2 cells. You can see the logic is this 25 should include this 100, and because you have put 100 women, this here the number should be 100 or more than 100. If you put 80 here and if you put 100, it doesn't go, which means that there should be at least 100 total women where all women are persons with disabilities, and this total number of persons with disabilities should include this women. Until then you don't see the yellow coming back. So if you put again 125 here, you can again see that women here there. So it's a logic chain link. So until you enter the correct numbers, you'll keep seeing the red columns. So the partners, when they are filling in, they should make sure that they are filling in the correct numbers. If you want, after this section, you can just use the statistics form, download on your desktop and play around a little bit just to make sure that you are very clear on what is being explained. If it is not clear, please contact us so that we'll help out to make it clear. Okay?
Sorry, Pankatish.
Yes.
Can you allow me to ask you from this stupid question that you said? Here, from the what?
Yes.
From the top, I mean, the top 100 shows a total, especially on adult men who were screened on I mean, total adult men, is it 100?
Okay.
Yes.
This one, your persons with disability,
No,
no?
no, number
This
of
one?
persons in general.
Okay.
Yes.
Okay.
The downward is number of persons treated with vitamin A.
Mm-hmm.
That is 50. Am
Yeah.
I right?
Yeah.
And the last one is number of persons screened.
Yeah.
Which is 8.
Yeah.
Is it not 80 and 50, which was to make total for 100 on top?
No, that's what I told you. Here, the person should be counted for this row ST2000. The person should be counted only once. Okay.
Okay.
And out of this 100,
Yeah.
80 persons can be coming from screening, and out of this 100, 50 persons might be given vitamin A. But there might be 30 persons who have received vitamin A and who are coming from screening. That's the logic. So this one,
Okay.
this one, and this one, it is a part of 100. You mean to say, for example, you cannot say I have distributed 250 for 250 people. There is vitamin A distributed, but the persons reached on the top, you give only 100. Then you see a red mark there.
Okay. Okay.
You get my point?
About the 150 to 100 on G. How does that come about? 150, then you have 100 in the number of persons screened.
This one?
Yes.
Yeah. See, the 100 persons are coming from screenings. The other 50 might be coming from, there might be follow people from previous year. 50 people who are receiving consultations or treatments in this year. Even those needs to be counted because those people are also receiving services in 2017 first semester. So they will be, you should understand that each person should be counted once per every year of reporting. For example, if a person is screened in the previous year and he is receiving consultation in this year, then he will be then it should be recorded in previous year also and this year also.
Venkatesh, it doesn't only have to be previous year. I mean,
Yeah.
if you're in a village and you heard about the medical clinic is there and you can go there and you go there and you're a patient, but you weren't part of the screening.
Yeah.
Not everybody goes
that
to
might
a
be this
medical
also.
service because they have been screened. They just heard or were informed, or some family member knows about it, and they go there to receive the medical treatment and the consultation. And others may have been part of a screening and then sent there actually. So and the total on the top catches both. The thing is, thereof codes, wherever you see thereof number off, this is always an independent figure, part of a total. Kind of. And that's probably something I also was wondering, Venkatesh, whether from a optic point of view, we should have made the totals in a different bold or different color than the other figures. I was really wondering if that could help. I don't know what the others think, but probably it would make it easier to understand that there is something different between the thereof figures and the total figures. Because it seems that this is something which is not so easy to understand and to get the head around. But that is something when the program officers are talking to the partners, they have to explain probably right away what a total is and what a thereof code is. So they understand that the thereof code is always part of a total and is like an independent figure. Well, not totally independent, but it has to be less than the total, of course, but less or equal, but it can't exceed the total. But it's a part of it. So yeah, I don't know. Maybe for the next time. I mean, we can't change the statistic form now, but we will think about doing something to make it look easier or easier to understand, probably in some way, as regards to the design. But I hope everybody kind of understood this now. If you still haven't understood, just ask again. This is important.
Yes, because this is the part which goes to the as a figure for the global report, and which will be reported this line. This will be reported for it will be given to all the advisors on global figures. Wherever we are representing CBM, these figures will go. So it's very important to know that these are reported correctly.
Venkatesh,
yeah,
I have a question. We're dealing with right now in the Vision Eye Health section. And but just above that, it says number of persons receiving screenings, consultations, treatment. Now, why is it that vitamin A is treated as the only treatment? What if a person goes for surgery or gets any other sort of treatment?
All the all the others are in the operations, and other things are down. If you come to the next sections, you will see what are the type of surgeries and other things. And I don't know whether you were aware of the previous forms which was in 2014. Just for your information, I'm telling, till 2014 we had 7 to 8 different worksheets for each impairment, and it was around 450 or 430 codes, statistics codes, that the partner had to fill in. After various consultations with all the stakeholders, from MAs to regional officers, advisors, everyone, they said this is the minimum the information that we need from the statistics. So those are the things that you see now on the statistics form, and not everything. This vitamin A, CBM Germany needs as a separate one, so that is there as a separate line.
Yes, and on the top here, we count number of persons. That's because we have to have the number of, because the total, which is the pink cells, goes into the core activities where we count the number of persons CBM, or let me say rather the partners for CBM, have reached this number of persons. Then below you would have interventions. That's a different thing if you count persons or interventions. Then you count the treatments, the surgeries, and all this kind of.
Yeah.
But the thing is, we still need to have, also from history, the MA's report on the number of persons reached in CBM's core activities. That's like the figure coming out and being reported.
Yeah.
And we are aware that this is kind of not so easy for projects to count number of persons. So for this is, we have tried to simplify. Maybe for 2018 we can think of something, but like a registry or something, but we have to have the number of persons. And people have to be aware, on the top is it's persons and then it's interventions. You have to be careful with the headings, what's being counted.
Yeah. Yeah, thank you. And also we have not changed the logic from the previous year statistics forms. Whatever the logic was there, we are maintaining the same logic. Okay, if there are no more questions, then we'll just go to the next section here in hearing care. It is the same like the vision section, what you see. The first line is number of persons registered, means reached in EHC for 100 or 50 or 25, 75, something like this. And this is the total number of persons reached in this semester, in this year, by this project in EHC. There might be a case a person is receiving both vision services and EHC services. Then he should be counted under both lines. Is it clear? If a person is receiving both vision and EHC, then he will be counted once here and once here. And there might be the case, for example, a person is receiving vision services in the first half of the year and hearing services in the second half of the year. Then he will be counted under vision in the first half of the year, and he will be counted in hearing and hearing care in the second half when they are reporting in the next semester. The same logic of screening. So maybe the same thing. And this is number of persons who have been identified as candidates for a new hearing aid or any other hearing amplification device. You can just say identified people. It may not be that they are receiving the hearing aid, but they have been identified for getting a new hearing aid. Okay.
Sorry, Venkatesh.
Yes, please.
You have said a person may have a visual impairment, as well as he or she is having also hearing impairment.
Yeah.
While you are taking us through visual impairment, you said the person is counted only once. That was clear.
No,
now, does it mean that if...
Yes, sorry? Yes. Go ahead.
Does it mean that if a person is counted on a visual impairment, at the same time the one is having hearing impairment?
Yeah.
He or she be recorded also for hearing impairment as independent, or that is double count? I mean, how is it treated? Yeah,
that's the logic that's been followed from previous years. That's how we are counting that. That's what Karen said few minutes back. We have not changed the terms and type of counting. We know that a person might be counted in different lines. For example, a person, if he is receiving vision, if he is receiving hearing, for example, if he is receiving physical, mental health, and any other, he will be counted 5 times. We are aware of it. But till we finalize we come out with a new thing in something like 2018 or 2019, this is the logic we are following, and we just follow the same logic.
Yes, it's not impairment, it's medical services. So you could, a person can, yeah, it's one person can go like to an eye clinic and receive some treatment for the eyes, and then they go to the, for example, orthopedic clinic because that person has also back problems.
Yeah.
So that person would be counted in the eye clinic, and it would be the person would be counted in the orthopedic clinic.
Yeah.
So in fact, there would be kind of a double counting in a way. But the thing is, usually you would have an eye clinic would be one project of its own and one log frame on its own and should have one project number. Ideally, the orthopedic clinic would have a project number and would also be a project of its own, so you wouldn't have this kind of doubling in one project. There is, of course, projects who have these monster log frames, having everything from eyes to ears to I don't know what. I sometimes think, also for the sake of being manageable and monitoring a project and all that's going on in there and indicators and whatsoever, why not have 2 or 3 log frames instead, which is smaller and more handy than having this huge big one log frame under one project number. I sometimes don't get my head around that, but yeah, people kind of feel they pack everything into one, and then it's a huge thing. And I feel, as from data, it's not so exact, and it's probably not so easy to monitor. I always recommend cut it into manageable pieces, which are easy to control. You could have it as sub-projects. You could also say this is part of a program. But yeah, and then it's not a big, it wouldn't be such a big deal also then, because you suppose in each area that will be like a separate project, and then it's okay. But of course it could be the person is in 2 services and would be counted in 2 services, and then that person would be counted twice in a way. But that's how from history this has been done, and until further discussions it will stay like that. I don't know if that's well, I don't know, things are always going to be discussed and whatever, but this has been like this for 25 years, so so far. I hope this is more or less clear. Yeah.
Yeah.
Yes.
Thank you. Any further questions on this? So the same logic applies to physical, and same logic applies to mental health. So the first lines what you see here are total number of persons, and if wherever you see a thereof code, it is a thereof code for the total number, right? Okay, there are no more questions. I'll just go to next line, which says the same logic here also, which says thereof number of children 0 to 5 years of age screened or examined or treated, which is early intervention, which means that, for example, if there are 175 total children reached in medical services, out of this 175, how many are in between 0 and 5? It may be, say, okay, 50 are in between 0 and 5 age, 50 boys. Out of these 50 boys, how many are persons with disabilities? It may be, say, okay, 10 are in persons with disabilities. 10 boys are persons with disabilities. Just in case, for example, there are 175 girls reached, and say, okay, there are 100 girls who are screened in between 0 to 5 age, but total girls in persons with disabilities is 200, then you will see a pop-up in red, which means that there is something wrong. You have missed something, so they have to correct it. So until you see a correct figure, the red will not go. Okay.
Yes.
Yeah. Oh, yeah. Any questions? Okay. So the next line would be this statistics new forecast, which means persons projected, that is approximate figure, the people who have which the project is expecting to reach in the next 6 months. For example, here you have 885 as total for first half of the year. In the second half of the year, what is the projection of this one? In first half they have reached 885. Say okay, they may say that okay, in second half we might reach 1000, or based on their work they might say okay, this is just a, as I told you in the CBR and education section, this is the number that we'll be adding and seeing for the projection sake, how many persons that we'll be able to reach in the core activities in the total year or in the next 6 months, and if there is any variation from the previous years. As I told you in the beginning, if for example in the previous year we have reached 10 million, and this year after adding all this including projections, if we are coming to 9 or 8 million, then we can take some precautionary action where we are coming down and how can we make it, if there is anything problem, or if how we can make it up, or how we can take the measures. And also the MAs know that okay, there will be a certain reduction in this number certainly, and they have to prepare for it and to take next steps. So this is related to the medical section. Any questions on this new statistic forecast? Would you see that it would be feasible for the projects to enter this number, or would you feel it would be difficult, or just give me some reactions? What do you feel about this new code?
From my end, I can find that it is also feasible because
Okay.
during the planning, partner used to give the whole targets that they expect to reach within the specific year.
Okay.
So at the middle of the year, that is now or in June.
Yeah.
Based on the reports that we expect to get it for 31st of July.
Yeah.
They're giving us what they have achieved from what has been planned in the total year. I mean the whole year. Yeah. If yes, it will also be fine for the what? For the for the partner to give what will remain or which is forecasted in the upcoming period.
Yeah. And also, as Karen rightly said in the chat, for example, if a project has said they would be reaching say 5,000 people in 2017, but if you add these two numbers, if it is coming below 2,000, then the program officer in advance they can check how come it is so low, and if there are any reasons for this, so that it is recorded, and we are sure that it will come down, or if there is any corrections needed, or if that can be done. So you feel that this is a feasible one? Yeah. Yes, Karen.
Yeah, I think it's also going to be useful for you as program officers. We will definitely analyze on it, and when you see it's far below what was expected as target, then there must be something going on, and that's like an alert also for a program officer to check with a partner. So what's happening here? Is there something going wrong? Is there deliveries not coming? Is there, I don't know what, things that might prevent the partner from actually doing his activities or something? And that's something which is not good. So that would give you the chance in the middle of the year to probably still improve or get some barriers moved or something that is hampering the project work. So, and it's really basic figures. It's the number of persons in the medical services, in the education services, and the CBR services. It's not detailed. It's a very rough number that every partner should have. So, as you said, there shouldn't be a problem really for them, and it can be really useful.
Yeah. Okay. Thank you, Karen. Yes. If there are no more questions, we'll just move on to the next section. Okay. The next section would be operations or surgeries. Here you can see vision eye health, which the partner cannot edit. This is with the formula. They can enter only the cells. And if the partner is here, there is no persons with disability. Here we are counting the number of surgical procedures. This the partner has to make sure. For example, one person is having 2 cataract operations for him, then he'll enter 2 here. It is not person counted, it is the number of procedures or number of operations that has been conducted. They are counting. That is, for men how many surgeries, for women how many surgeries, or for boys how many surgeries, and for girls how many surgeries they have done, how many cataract operations or surgical procedures they have done. It is not number of persons here, it is number of surgical procedures that needs to be counted.
Okay.
Yes. As like an example, 1 person, 2 eyes, you put 2.
Yeah.
1 person, 2 legs operated, you put 2.
Yeah. Yes.
Hello?
Yes, please.
What if a person had 2 eyes cataract surgery?
Yeah.
Then after a while, for instance, 2 to 3 months later,
yeah,
he or she did not manage to get, to be able to, the vision is still not treated.
Yeah.
Then he or she has gone for the second, what's called surgery, both eyes.
No problem.
How are we scenario?
Yeah, here, as I said you, it is the surgical operations that we need to count. It is the surgical operations. How many operations they have done? That it need not be for the same person or for a different person. It doesn't matter. It is, for example, if the project has done 100 cataract operations in total per year, then they have to just give how many were given to done for men, women, boys and girls. That's full stop. A person can be receiving 1 surgery, 2 surgery, 3 surgery, or any number of surgeries. That doesn't matter here. It is only the operations count.
Yes, this is like really showing the workload. I mean, you may have a patient, that patient or 1 person has 1 surgery and done and healed. But then you may have been a person like for some orthopedic surgeries which are really lengthy, you will have to operate like 4 times until you have restored some limb or whatever in a worst case. So that person has like 4 or 5 surgeries, but then you would only count that person once, but
on the top,
the workload on it would be a different one. So this, from here, we have this number of surgical procedures, which is really showing the work and the surgeries that they are doing, not the persons, but the work that they are doing. And this is regardless the persons.
Yeah.
Okay, it's clear.
Okay. So the same logic applies to hearing and hearing care and also physical. If, say, for example, there might be 25 mid-ear surgeries done and say 20 ear operations for boys done, you have to make sure, say, for example, there are 45 EHC surgeries. For in that, how many for men and how many for boys? This breakup should be available with them because they'll be doing the surgeries and they know the how many men. This is not a new thing. And for as Karen explained, a person might having many surgeries. For example, you might be having 2 times, or here only the surgeries or the procedures are counted. Okay.
Yes.
Okay.
Yes.
So here you get the total number of surgeries done by the project in the reporting for the reporting months. And if they want to add comments, they can just comment for that particular row. Next, if you don't have any questions, I'll just move on to the next section. Okay. Next section is on training health. Here you count the number of participants for each training. For example, an eye specialist might be a, for example, them for each training, how many participants they are having, only that will be counted, and they'll not, the project need not worry whether the same person is attending different trainings. If a person is attending different trainings, then he'll be counted under different trainings. It is just number of participants. For example, if a project has done 2 trainings in 6 months, and the total number of participants for in both the trainings are 100, then they just fill in how many participants, out of which how many were eye specialists, orthopedics, all these things. I think this not what to say, not confusing. That's what I feel. They just count the number of participants, and they just give out of the participants how many were eye specialists in the projects, how many were trained, who have been attended for the trainings. Is it clear? Or
yeah, in fact it is clear. But yeah, I would like to ask you, why have you not considered on the issues of specialists being a nurse or a doctor with disability to be reported specifically?
I didn't get your point.
I'm asking, and under this section, why have we not taken into account on reporting about those specialists, being a doctor, a nurse, or whoever, who are having disabilities?
Yeah, that's really a good question. But as of now, it is not there. But this might come up in the next year. But as of now, it's not there, and I think it is not being required by any of the stakeholder. As I told you, we consulted all the stakeholders, and only the minimum required thing is there in the stats form. There are many other things which are not in the stat form. For example, as you said, there might we can give the persons with disabilities here, and we can say, for example, okay, 5 eye specialists and 10 hearing physicians were trained, and out of these 5, how many were persons with disability. That's really makes sense. But as of now, we are not asking in this statistics form.
Okay.
We wanted to keep it still as simple as possible and not burden too much. But as Venkatesh said, it might come up. It makes sense, but it's more figures that the partner would have to count and to enter here. And then we still haven't, like, an official way that CBM tells partners how to count persons with disability as such. There is various, let me say, techniques out there that they say, okay, this is a person with disability. There's, for example, this Washington group questions going on for self-identification, like interviewing, which is not as easy as people think sometimes, but like that. Or CBR projects, when they register, is a mixture probably of questioning and also diagnosis. That's something we still have to really give, like, an official way of CBM saying, okay, this is how you should identify persons with disability, and then there has also to be some capacity building around it. But so far we haven't really done that, and we don't want to overburden partners while we don't really give them something how to do this. That's basically it. I really have to go back. We are looking into this, and there's a working group. How education projects and CBR projects have done this, even with the type of disability, and they have certainly methods how to identify the disability. And then we have to see the medical projects, what to tell them in the eye departments, for example, how to count the other disabilities or how to identify. And it's not really, this is why we're not publishing the figure on the top yet, because we feel it's not stable enough yet, because it's not really specified. And until we haven't really done that, we do the minimum, basically.
Okay. Yeah. Okay, thank you.
Yeah. Thank you, Karen. Yeah.
A question.
Yes.
In regards to the training.
Yeah.
I'm just wondering what happens if you have a long-term training where you're training like doctors for a period of more than like 3 to 4 years.
Yeah.
So that it would mean that, like, let's say in 2017 you're planning to train 10 doctors, the same doctors. So that will mean that in the January to June report, you will report 10 doctors were trained. And then in the June to July, July to December report, you will also report the same number of doctors were trained. So at the end of the year, the report will say 20 doctors are trained, but in actual sense, it's 10 doctors that were trained because it is a long-term training. So what happens in such a case?
Yeah. In that case, one is, as you said clearly, that it has to be for here we count the number of participants, and we don't worry whether the person is counted once or twice. That's the first logic. And if the same 10 doctors are trained in the second half of the year, then again they put 10. So total number of participants we report in the training. And actually we in the report of activities we say that so totally 20 number of participants have attended the trainings. That's how we report in our report of activities. You get my
now
point?
in actual sense, it will just be 10 doctors, because I'm just thinking it's the same doctors being, like, it's a training, it's a master's training course, and it takes like 3 years, and it's the same doctors. So meaning if we say 20 were trained in 2017, it will not be true, because it will be double reporting, because it's just the same training, the same doctors. Yeah.
Yeah, I think she's right. The thing is it one training or is it 2 trainings? I mean, it's like a participant per training, and if the training goes the whole year, then it's one training. If the training is like a course that is in the first half and another course in the second half, it would be the participant would be counted twice. But if it's like one training for 1 year,
so
it's one.
Yeah, for that one, we just have the final line here. For example, if you see 110,
basically, I think that's how I identify.
Say, for example, there are 5 total men and 10 total in the health of training. This one will show thereof total number of participants graduating from professional trainings or receiving a certification. So here, if the medical doctor is receiving the certification in that period of report, for example in March 2017 he is receiving that certificate, then we'll just put as a 1 until he receives a certification. He'll be counted on the top. Once he receives the certification, he'll be counted here. He will be counted on the top as well as here, so that we know out of 5 only 1 person has got the professional training and who have received a certification, which means to say that if there is running for various months or various years, then the person who gets the certification, that will count in which month or which year he has got the training. Means, but for every year they have to report when they are receiving a certification. Is it clear? Or
but I think it's to be honest, it's like a weakness that you count the 3-week training a participant and a 1-year study a participant, and you're counting both in the same cell.
Yes.
It's kind of a weakness, but it also makes the way of counting simpler. I mean, if you really want to distinguish, you would have to add more lines and specify the way of training and the way you ask for the training. And in order not to have blow the statistics form further, it was decided that we would have just this one question code for both of the types of training. But it is not exact. I mean, that's true.
Yeah.
I mean, it depends what you think. It's better to have a more specific question and separate these kind of trainings. type of trainings and courses, or and have some more lines. I mean, that's also things you can give as feedback. If you feel like this is not a good thing to have, we will always be thankful for suggestions and feedback from the field. So in the experience, this doesn't really work.
Yeah.
The idea was to keep it simple, but sometimes simple is probably not simple. Well, yeah. Depends. I mean, yeah.
And
but
also,
the intention was very good to keep it simple.
Yeah. And if the project wants to give the comments, they can just put their comments saying that these 10 people or 10 doctors have training for which are also counted in the first quarter and again repeated in the second quarter because of these reasons. Then that will also go into the Navision, so it will also help us to know how many projects are reporting like this on a global level. So that is there any measure?
Or they could say, yeah, or they could say these 10 doctors are part of university study or whatever,
something
and
like
are
that.
only being counted once. Yeah, something like that. Give some explanations which go with it.
Okay.
Yeah.
Yeah, that's clear.
Okay, thank you. Is there any further questions on this training section? Okay, then I move on to the next section of called assistive devices. Here, number of assistive devices are counted and not persons or any interventions. For example, if a project has dispensed 100 spectacles, say 50 have gone to men, 50 40 women, 10 boys and 10 girls. It is number of spectacles, for example, number of spectacles dispensed by the project. And it doesn't matter whether a person is receiving a spectacle as well as an hearing aid, or a person is receiving 2 hearing aids, or if it's, or anything it may be. Here only the assistive devices, as a device it is counted. Right? Okay. Any questions or clarifications on this section, assistive devices? Okay, there are no questions, then I'll move on to the next section. This is intervention therapy and rehabilitation. Here we count number of interventions. A person, for example, might be having say 20 therapy occupation or physiotherapy. He might have gone 20 times. Here the persons are not counted, only the workload of the project is counted. For example, if the project is conducting 100 physiotherapy sessions in a year, how many were given to men, how many were given to women, how many for boys and how many for girls? This is what is counted, the workload of the project. The interventions, or the, for example, the physiotherapy sessions are counted and not the persons. Yeah, is it clear? Or
no?
Yeah, yes, Raina.
Hello.
Yes, please go ahead.
Yes, what I've just noted here, that this particular of the physiotherapy or occupational therapy is something that needs to have, to fill the total in the column ST 3610.
I didn't get
now,
you. I didn't get you.
On physiotherapy or occupational therapy, in this particular line, is what we're supposed to fill is just to fill the total, the total figures of boys, men, boys, girls, men, and women. Now, what if the same person is also having clubfoot or manipulation?
Here we are not counting number of persons. It is therapies.
Okay.
For example, if the project has done 100 physiotherapy sessions, out for that 100 physiotherapy sessions, it might be only 4 people who is receiving 25 sessions in a year. Just to be very simple example, they should not put 4 here, but they should put 25 here. For example, 4 people are receiving 25 sessions, then they put 25 sessions here and not 4 people.
Okay, thank you.
And for example, if the same 4 people are receiving say support skills or something, they say 15 support skills, then they put 15 here and not the persons here.
Okay.
For example, 25 women who are receiving physical therapy are also receiving say 50 sessions for clubfoot manipulation, then they put 50 here. So it is number of interventions or the sessions they are undergoing. This just to know the workload of the project. It is not the number of persons here.
Thank you. That's okay.
Yeah. Okay. Any further questions on this? Okay. Then I just go to the next section, that is referral and facilitation. Here you have number of persons and thereof number of persons with disabilities. There are 2 lines, one is referral and one is facilitation. Referral is just referring the person, saying that, for example, simple example is if it is an hospital, just for example, and they do not have any rehabilitation services at their end, what they say when they see some person, they say okay, just they refer to that person to some rehabilitation center. That is just referral. They just refer it and keep quiet. That is referral. The facilitation is, which normally comes in the CBR projects, where they do all the work. For example, if they identify a person and say that okay, he needs a cataract surgery, they will speak to the doctor and they will arrange for a transportation, and they do everything, follow up everything, but not the cataract surgery. Then it becomes a facilitation. Refer is just referring the persons to other services, and facilitation is doing all the facilitation job for the person to get it treated, to get the treatment or get the access to education or get the access to the rehabilitation, something like that, and not do the actual work. For example, as I said, the CBR project doesn't do actual cataract surgery, but they do facilitate and do everything apart from cataract surgery. That is facilitation. Are you clear with these 2 lines, referral and facilitation?
Can you allow me to ask a question?
Yes, please.
Yeah. There's a partner is having, let's say a disability hospital. The same partner is also running support units for rehab services.
Okay.
There are some patients come with the rehab service, rehab unit, then referred to the disability hospital for service. And once he or she gets some service at the disability hospital, then the same patient is again referred to the supportive unit to continue getting some services.
Okay.
At the same time, partner is also getting some patients who have been referred from other facilities not run by the partner.
Okay.
Are all these numbers to be entered in this referral?
It is very simple. Say, for example, what is the partner, the project reporting? For example, on the top, if the project is reporting everything, both hospital figure and CBR figure, everything, then they will put it, the referred people, what they have referred from their hospital to other units, they put it under referral, and the subunit which they are supporting or doing the facilitation, they put it under facilitation. A person can be referred and as well as facilitated. For example, there might be some cases where in the first half of the year they just refer, say okay, go to this rehabilitation center, and they just refer it, but it doesn't happen. Sometimes they have to follow up and do the facilitation job, then they put the person will be again counted under facilitation.
Okay, thank you.
Venkatish, I also thought this has a slightly different angle, what you were asking as well. Like you have a partner who's doing one clinic part and a rehabilitation part, and both are under one project, right? And that's, again, it's coming back to ideally have the log frames cut into manageable pieces and have one for the clinic part and one for the rehabilitation part, and a bit smaller and manageable with good data and with good indicators, or use the sub-project function ideally, and then it's not such a mess. But of course, there is a referral and there's accounting. But if you pack everything under one project, it looks weird, kind of.
Yes.
But yeah.
And also, if they, for example, they can use 01 for reporting the hospital data and 02 for their subunit for their CBR data, reporting their CBR data. So 01, when they are putting the hospital data, they can put their as the referral numbers, and when they are reporting under 02 CBR subunit data, they can put those number under facilitation. So it is very clear.
Okay.
Okay.
Yep.
Okay. Then we move on to the next section.
Venkatish.
Yes.
Please explain the last statements that you said again.
Yeah. Say, for example, there was a question saying that if a hospital, if there is a project which is doing a hospital as well as they have a subunit for doing the CBR activity, right? The same, for example, the same project number 2568 BMZ MYP is a very big project, and it is having a hospital as well as a CBR unit. What they can do for report, they can split the statistics into two forms by using the same project number, but they use 01. They say it as hospital, and put the data, all the data relating to the only hospital in the statistics form, where the people referred here, they'll just put whatever they are referring to the subunit, they just put it here as referrals. And next, when they are reporting the CBR unit, they just make the same form, use the CBR, and they put those things under not referral but under facilitation. This is possible, but if they don't want to split the data and they just want to put everything, both referral and facilitation, under one number, then it will be nothing but the same numbers reflected in both the lines.
Okay, and in a situation where you have a cluster, so splitting would be an easier option. And, if you have a cluster that
and also it would be easily manageable.
Okay.
Also,
okay, thank you.
Afterwards, you can always also request the data separately. If it comes in per unit, it's going to be added up, but it will be we will always be able to take it out as units as well.
Yeah.
So if you want to have an overview about the different projects in a cluster or units or districts, for example, some also in NTD, they report per district, for example. So if they have to know, okay, in this country, in the 5 districts, so what did we have? We can always give also the districts as well as the sum, and it's easier for them to count to count every district is delivering its own figures basically, and that's easier for them, and they don't have to make up the total. And if you have projects in your statistics where you think, okay, it would be easier if they kind of, for the units, they report separately or whatever, you can use the subproject function to subdivide, basically.
Yeah.
And you don't have to aggregate those figures.
Yeah. And only thing, one has to make sure that in the first reporting, if they have taken 0, 1 for hospital, when they are reporting for second semester, then they have to ensure that 0, 1 is given for hospital and not for CBR. For if you want the continuity and the comparison for different quarters, this logic what you use in the first quarter reporting, the same numbers and should be used for the same hospital or district in the next semester. Yeah. Any further questions?
It's okay.
Okay. Next, we go to the education and livelihood. This, on the top, you have education numbers enrolled. Here you see number of persons with disabilities accessing education in integrated or inclusive settings. Say maybe 20 men or 20 women and 150 boys and 100 girls, something like that, in integrated and inclusive settings. And there might be the next line would be number of persons with disabilities accessing special education, might be 50. I'm just kidding. Okay, so there are 390 people who are accessing integrated and special schools. Out of this, you see already a red mark for 4301, right? This 20, out of this 20, how many are in preschool? Say 10 are in preschool, say 5 are in primary, and 5 are in secondary. So automatically the red goes to that column. It is very simple logic. This is a total of this total. How many are in primary? How many are in secondary? And how many are in primary, secondary, and preschool? So if it doesn't match, or it might be okay. So if everything is entered properly, you don't see any red cell. Just for example, if you just put, okay, you say the total of people who are in primary, secondary, and preschool, you say 490, but here on the top you say only 390, then there is some problem. Either this is not correct, or if you are missing something. For example, total are 250, but you say people who are in preschool, primary, and secondary are only 150. Then there is something, the 100 are missing. Where the 100 other people are there. So either they should be in primary or secondary or somewhere. Very simple.
The thing
yes.
is, yeah. The thing is, the first part is asking whether this is a special school environment or whether this is like an inclusive setting, inclusive environment. And the second part is asking about the level of schooling they are in. It's like two different dimensions. One, integrated or special schools, and the other is of those who are in pre-primary or secondary. So what is their level of schooling? And this figure can be higher if you have a CBR project and an education project in one statistic form, which is not ideal, but that happens. And the CBR project is also doing some education. This figure may be higher than the registration and education. But ideally, you would have, that's something that might happen. Ideally, you have one form for CBR and one form for education, then you don't get this kind of problems. But
if this is the case,
but
please go ahead, Karen.
No, but the important is that the sums below here have to match, because one dimension is inclusion are special schools, and the other dimension is level of schooling, but it's about the same students. Yes. And that's why the total has to match. Okay, Venkatesh.
Yes, thank you, Karen. And as Karen said, if it is a CBID project and something they want to report everything in one statistics form, and the totals are not matching, just for example, and the numbers what they have given is correct, then they can just give a comment saying that why it is not matching, so that we know the reason why it is not matching, even though the numbers are correct. You get my point? Any questions?
I think it's clear that there can always be comments.
Yeah.
I think we have to hurry up a bit, Venkatesh.
Yes.
It's 9:37.
Yes.
Timekeeper.
Thank you. Next section is training teachers. It is something like this. Training, what we have for medical, this is for education. The same logic. You count the number of participants, and there are participants with disabilities. Regular teacher, one teacher may attend many trainings, but it is number of participants counted and not teachers or persons counted. Okay. The next section is livelihood. The same logic which we saw on the top in the number of persons and thereof number of persons with disabilities. This is, for example, number of persons receiving vocational training long term. Say, okay, there are 50 men who are receiving vocational totally long term training. Out of them, thereof, which means out of this 50, how many have received inclusive, who are trained in inclusive or mainstream training? There may be 20, but you cannot say there are 80 people who are trained in inclusive mainstream setting, but the total people trained in the professional or long term is only 50. Either this should be 80 or it should be more than 80. Just the thereof code, the same logic. Any clarifications required? Okay, then if no clarification, yeah, yes, please.
On the part of training, I mean, regular teachers trained, including students who are studying to be a teacher.
Yeah.
Specialist trained. Now, I have a question over here.
Yes, please.
There are staff who may be trained on sign languages. Now, should they be included here, or where should those be reported? Partner staff who are trained on sign language, for instance.
Just for means, I think it is a specialist teachers trained. It would come under this category for sign language.
I mean, partner may have a program from which, because the partner is working on disability, in disability aspect, and among the hearing impairment, then he have a program for every month to train the other staff on sign language.
Okay.
Now, if that is happening, where will the partner report on this, on these staff who are being trained, in order to ensure that as far as they're working on disabilities, they are able to have, to have skills on sign language?
Okay. I think it will come under specialist teacher trained, or you mean to say the project is having a regular teachers, but who are trained on sign language. That's what you mean, right?
Yes.
Yeah. Then if it is a regular teacher, then it would come under regular teacher. And if the project or the regional office or country offices is bit confused to put under which of the row, they can just put in the comments.
Okay.
You can use the comments column. But if it is a regular teacher, yes, Karen.
Yeah, this is really a good question, because if I understood, it's not also only teachers going to be trained, it's also other staff being trained to be able to do sign language or whatsoever. Because this is teacher training, also the wannabe teachers to be trained, but it's not kind of capturing really any other stuff. This is a good question for Sean to see for the advisor. I just think put them in there. I would count them, even if it's not like official teacher to be trained, but they're going to probably have this training and use it and do some teaching or whatever. This is also the students are to be counted, so I think probably the staff could also be counted, but it's not totally clear. Now we should ask the advisor about that, if there should be another line or another explication on that. For the time being, I would just go for yes, I count them.
Yeah, and with the comment.
Okay, thank you.
Just put a comment.
Yeah, count them with a comment. That's probably good. But it's a really good question that we have to clarify.
Yes. Yeah. As we said in the beginning, we are doing many things, but many things everything may not be capturing in the statistics form. So only the basic things what we required is being captured. If you find something like this, or if you get some questions like this from the project, where you just please send us an email so that we can check with the advisors, and we can see how the form can be improved for next year, or how the question can be tackled.
Yeah, it's far from perfect. Very far. We are trying to get better, but this is not perfect. So if there's something you find, let us know.
Yeah.
Okay. Thank you.
Okay. Any further questions? Okay. If there are no further questions, then I just go to the next section. This is inclusion and empowerment. Here you see it's very straightforward, same like participants, the same logic applies. Number of staff participating in child safeguarding or workshops, how many men, how many women, out of men, how many are disabled, out of women, how many are disabled. So these are all straight questions and they can just fill in.
Yes, as regards staff, because we are not supposed to have, as CBM, also as partners, we're not supposed to have people employed who are children, which means under 18 years. This is why this is plain.
This is, you see white, where they can't fill in.
As regards child safeguarding rules, that would be child labor. So this is why we blacked it out. Whited it out.
Right. This one's. And here. Okay. Yeah.
You may miss or not miss, depending on how far you have worked with the statistics. In the past, we had a question about staff being employed at the partner.
Yeah.
We have taken that out because a lot of partners had problems with it. We haven't really reported on it so far. And also we feel the staff being employed in a project, that's something you have in your log frame, in your budget papers, and that's something which is on a project profile, but not part of a statistic really, because that's some profile thing. It's not a statistical thing that changes every year really. So we have taken that out to make it simpler, just in case you are missing this. I think nobody will miss it, really. Not.
Yeah.
Everybody will be happy it's gone, but yeah, just if you wonder.
Yeah. Thank you. So next comes the empowerment section, where you put the number of participants, the same there of persons with disabilities. Here you see number of members and thereof members with disabilities. For example, child to child peer group, how many boys and how many girls you have, and of them how many are disabled or persons with disability, say maybe all are something like this. And for as explained, for every section there is a guideline in the last column, so you can just refer to that section, how what needs to be filled in, how it needs to be filled in. And for and on each cell you have, when you just put on it, the background message pops up what needs to be filled in that cell. So this is what is for statistics form 2017. And I just want to make one.
Probably you
Yeah.
show that you can move the background cell. If it disturbs your filling, you can just click on it and move it aside.
Yeah.
So it doesn't. You cannot delete it.
Yeah,
but you can move it. Yeah, because I want people to see it actually, and hopefully some partners actually read them.
Yeah.
But you can move it at the side.
Yeah.
This is also something, if you are blind and you are using a screen reader to look at the documents or to read documents, that will be a text the screen reader captures and reads as well.
Yeah. And I also want to add something, that all BMZ projects or EU projects or Australian or OSAID projects, all these things which might be having different reporting systems to report as per the MA need, they also need to fill in this statistics form without fail, except for emergency projects. Except for emergency projects, all projects need to fill in this statistics form.
Yes, and the neglected tropical disease projects are like 13 or 14, or how many are they this year? Every year they are defined, and the work on they do within this range of neglected tropical diseases, officially with WHO or whatever, they are reporting in a different form as well.
Yeah, for NTD form, we'll have a separate session only for the concerned with the concerned POs or with the concerned regions, so that to make it clear, that will be a next session. This will be a general form which will be filled in by all the projects. And if a project for just for chance, if it is doing both NTD and general medical services under the same project number, then they have to fill in both the forms, which might not be the case, but in case if it is having the same project number but doing the general medical work and also NTD, then they have to fill in both the forms. But the NTD forms are for yearly reporting, and they are not semester wise.
Yeah, but it's really the projects and who is doing these official neglected tropical disease work, that's being defined. So it's not, if a project does some NTD work, this doesn't mean it doesn't not, it may still be regular work. It's just like 15, 14 projects that are actually being defined as NTD projects, basically.
As pure NTD.
And those are filling this annual, as pure NTD work, kind of. So this is for regular project work. This form is like emergency is also not regular work. That's also exceptional.
Yeah.
This is for regular project work that's going on in a project.
Okay. Again, I just want to ensure that you please go through the form after this session, play around it, and if you have any questions, just send it to us. We'll try to answer you, or we'll just check with the advisors and get back to you. And if you get any replies by the projects when they are if they are finding some difficulties in filling the form or understanding, just please let us know. We'll try to help out whatever possible from our end. But please make sure that this is coming on time, because we need to give the report, half yearly report, by August. Once it is by July 31st, it will be closed as informed in the email. From 1st August, whoever the projects who have not submitted the statistics, they will go under proviso, which means that the budget will not be released until the statistics have been submitted. So please make sure you inform the partner and follow up with the partner, and if you have any clarifications, try to send us the emails and we'll try to clarify out. But please ensure that the statistic forms are arriving on time. It may be before 31st. You need not wait till 31st July to send it. If you are receiving in first week of July, fine, you can just send it out and we can just say, okay, this is fine and this is being closed and there is no proviso on it. So please make sure you send the statistics, filled in statistics form, you get and send it to us as early as possible and not wait for the deadline.
Yeah. As Venkatesh said, take the phone, write us, Skype us, whatsoever, for any problem. We will help you.
Yeah.
But please try to get it in on time.
Yeah.
So then in an effort together, that actually.
Yeah.
More or less.
Together we can do more.
Yeah. Yeah, together we can do more. Yeah, we really need your support there.
Yes, please.
But we also willing to any question. There's no stupid question. Anything that comes up and you're like, oh my God, how is it? And I don't know. And
feel free. Please feel free to write
phone
us,
us,
yeah.
Skype us.
Yeah. Whatever that is convenient to you, you do it. But ensure that it is on time, before time.
Yeah. Yeah.
Okay.
So it's
yeah. Any questions finally before we close? Last 2 minutes for now. Okay, if there are no questions, then thank you very much everyone for attending this session.
Yes.
A very short notice and making it possible. And please feel free to write to us or Skype us or phone us, and we'll try to help it out. And again, together we can do more. Happy day.
Yeah, I'm really thankful for your efforts.
Yeah, thank you.